One of the innovative aspects of the Reading Health System is the street medicine program, which has been active over the past year and a little bit more, and has encountered during that time close to 500 encounters with different individuals, providing care to those who cannot access care for a large variety of reasons.
Street medicine is a needed program because it fills the gap of the community resources that are available, and it plugs in the medical care necessary for the holistic approach of ending homelessness and regaining some of the basic functions in life so that people can be successful in whatever they choose to do.
Yeah, it's good to see you too. Bye-bye.
We are one of the relatively few health systems in the world who actually have a street medicine program, and we are part of the international street medicine community.
How we process the availability of services, how do we make these services available to people? Do we keep in mind the barriers that they may have? So as we're thinking about services to be offered to the community in general, are we really being mindful of access barriers? To say we're going to take 3 doctors out of the hospital, send them into the city, into tent sites where they're going to care for people with backpacks of medication. When you first hear that, you're like, whoa, pause. Let's think about that for a second. But when you really start to get into it and you think about the impact that these 3 docs can have, and you think about, okay, logistically, how do we do this? And you get to the end and you say, we did it, and we can continue to do it. And not only that, we can do it well. And we're doing a good job here.
Doctors have been phenomenal with us. They're great people. People have responded to that. They know that on certain days that the doctors are here. And it's not just, I would say, it's not just doctors per se, but they have a great understanding of what goes on with these people here. And it's the camaraderie that they have with each other, the doctor on doc and patient. It's not that, it's a friend to a friend.
Well, Dr. Jean is talking to you. I'm going to just take your blood pressure, okay?
A few of us physicians, really led by Eugene York, a phenomenal physician that we've been grateful to have as part of our internal medicine residency program, had the innovative idea to be able to say we have this known idea or known entity of having patients in our community unable to access our traditional healthcare system.
I'm just going to check your temperature.
Okay. Well, with Dr. York, this is the second time I've seen him. The first time I needed sleeping things, and he gave me prescribed something for my sleeping. Today I saw him was for a bad cold, and he's great. Right away he does everything for me. I have no trouble with him. I love him. I look very forward to seeing him when he comes here.
It's a system that's been traditionally a scary access point for a lot of people, especially homeless people, that they don't really trust our system. They might have been treated poorly or unfairly, or really just because of the time, unable to be able to sit down and really understand the complexity of all the issues medically and emotionally that they're going through.
My name's on it, and Dr. York's name is on it. That's him right here.
You can tell when they come down the steps, they feel that their questions have been answered. They feel that they was talking to a friend, not a doctor. You know, so that's a great thing.
We're grateful that we can help you guys just a little bit with some of these things. So.
Alrighty.
That's for you, Dave.
One of the constant feedback that we get from patients is that they go to a primary care office and they kind of feel like they're bounced around. They don't see consistency with the same provider. They are unable to get quick appointments when needed. Their visits are 15 minutes and they can only address maybe one of the 15 issues that they need. What we're able to do is we have the luxury of a little bit more time. We can be flexible since we don't have 15-minute slots that if I need a half hour for one patient, I can do so. But they get to know us. They have their preferences too. You know, we say like, oh, I want to see Gene York today, but or Andy Donato. But they kind of get to know us so much, and we know every detail about not just what their medical problems are, but who they are as a person.
Asked to team up with Dr. York to provide funding and more of like a strategic plan for the program. And so that's really what I do. I provide support to Dr. York and the other physicians that participate in the program. I've written grants to provide funding to get the supplies and the equipment needed. So if you're homeless, you may not always have someone calling you Mr. or Mrs. You may not always have someone showing you the utmost respect and being patient and being kind and being empathetic. What these patients are promised every time they see a street medicine doc is time with those doctors and time that is respectful. They have a sympathetic ear. They have someone who is solely there, who came out of their comfort zone into this individual's environment to say, how can I help you? How can I be of benefit to you? How can I be of service to you? That in and of itself is huge to people who think they've been forgotten. That someone would come from what some of them call the hospital, the big place on the hill. They would come down into the city of Reading and say, how can I help you? How are you today, sir? How are you today, ma'am? And again, these are words that typically don't follow this group. They don't hear that often.
So this gentleman who lives in a tent, you can see how painful it is for him to walk. Just watching him walk, very painful. And he has to walk everywhere. We have seen this gentleman for 3 times now, and we're trying to get him plugged into some health care. Isn't sure if his insurance is intact, really is in a difficult spot and really needs some help.
Street medicine, I think, in my opinion, is also successful because of the community support that we've received. And so when we first started, we asked the Berks Coalition to End Homelessness to sit on our planning committee, as well as Tony Calafetti from the Salvation Army, understanding that we really needed their perspective. So operationally, we can say this is what our docs will do, these are the days that they're going to go out. But we needed people who were on the front line working with the homeless population every day to help guide our steps, to say, what should we say when we go to New Journey Soup Kitchen? How do we introduce ourselves? And do we just show up with a bag of supplies and say, next? You know, how do we create that relationship?
About 10 years ago, volunteers from the coalition, other professionals who do street outreach, really saw the need for a street medicine program. And I think in other communities, they did begin this. I think Lehigh Valley went back that far. So a lot of people thought we really need to fill this need along with, you know, social work and street outreach addressing basic needs and shelter needs. Street medicine was something that really thought everyone thought we really need this program.
So this actually, a year and a half ago, was actually very functional. I mean, there were working tents and up to 10 people here. This has actually cleared out quite a bit. For most of you that are watching this video, you probably have access to both a doctor and quick care and ways to get some connections. For the most part, this is a pretty forgotten crew. They can't do quick care and they generally can't get to a doctor. So we are hopefully someone they can talk to and someone they can actually bounce medical stuff off of. We're doing our best to patch them together to get them on with their lives.
Doctors actually going out to meet them in their environment is it's critical. It helps them maintain connection with physician, with medication if that's needed. And what I have noticed is also that once they visit with the street medicine doctors for a period of time, then they do make an appointment and start reestablishing contact with their old physicians or mental health workers.
When we brought up that we were doing this, we were very surprised how many people said, wow, that would connect me with why I'm a doctor. This connects us with having ongoing patient relationships, and this is great. And there are probably 6 other hospitalists that have been out with us that feel this is what they really enjoy.
Oftentimes, men who are here, who are struggling with homelessness, oftentimes don't feel comfortable perhaps going to a lot of the same places that you and I go to. Sometimes they feel, like they are forgotten, that they're overlooked, that they, sometimes some men even think of themselves as second-class citizens. And through the program that the hospital is putting forth, obviously that's reminding men of their value. So the fact that the hospital is coming and meeting men on their turf and saying, let us help you, let us come alongside of you, is just such an amazing program.
The street medicine program came to us about 1.5 years ago, and the doctors asked, could we come here and meet with any of your clients that come here to eat or come to your food pantry that are in need of any kind of medical attention? We said, certainly, please do. And it didn't take long before there was a line forming right outside the room that the doctors were in for people to come to see them about a wealth of issues. Some of the issues related to things like diabetes or asthma. One person was having extreme difficulty walking and needed a cane.
I think it's the best thing that happened to Reading, helping people out. It's good that they do, and my thing is, them traveling down to the river and going the extra mile to help people. But they're good doctors, and thank God they come to the churches and help people out, like me and so on. There's a lot more people worse than I am and stuff with problems and stuff, and they do a good job. A lot of people respect them, and I do too, man.
Everything good back here? No trouble back here? I don't see too many people either. All right. Do you want one of those food packs?
There's been several community services going on for decades, and this is the first time in this community, in this county, that we've had doctors go into the community on a regular basis in a designed program to meet patients where they are, to meet new clients where they are, to help people with basic medical needs.
A year or so ago, up in there, it was almost like Buttonwood with all the tents. Then someone died and the police cleared everybody out.
As the physicians are in their territory, right? And so they're not having to sit in a waiting room amongst people who may stare at them, may look at them funny, may move over when they sit down. So they're in their own comfort zone. And the fact that the doctors entered into their territory, I think the walls come down a little bit. When the docs aren't in their white coats, there's no computer there, there's very little equipment, and they're just at a table. So it's just like you're in your kitchen and you're sitting across from your auntie or your mom, and someone says, hey, how are you? What can I help you with today? How are you feeling today? And that's really how the conversation starts.
So. After 35 years of teaching, I am convinced that you cannot teach empathy, you can't teach compassion, but you can learn it.
Safe, thank you. You too. Good job for the mosquitoes.
Yes, it is difficult for them right now to think about their health and to make their health a priority. But that's what we want to do. Right? So 3, 4, 5 years from now, do we want to see the same person getting treated at a street med site? No, we want that person to have developed a relationship with their primary care doctor. We want to be, like that will be what success is. We started to see you on the street, we started to see you at Hope Rescue, but now you're seeing your doctor on a monthly basis. Your diabetes is under control, your hypertension is under control. You're connected with your family. Maybe you're working, or you've received other support services. That's what success would look like for street medicine.
Maybe we'll see you there.
And one of the things that makes me happy is when we see people at their worst, and then months later, years later, they come back and they're at their best. And the street medicine program allows them to access that care where historically they would end up waiting until it was too late and ending up in the emergency room that I work in at the extremes of life.
I know that one guy that comes to mind in particular, he actually faced losing his foot. He was facing a foot amputation, and the doctors that came to the hospital, or from the hospital to the mission, met with him, made sure that he was getting proper care for his foot. They told us that through this program he was able to save his foot. So that's a miracle for that man.
We have one gentleman that didn't know he had diabetes and was, of course, the doctors do a lot of referral as well, but the doctors here taught him how to take his own sugar levels so that he could monitor where he is and what he's doing as far as his eating habits are concerned.
Living right here was a guy named David. David was a fairly tortured soul, a pretty big drinker.
Really, he had a wonderful relationship that was kind of falling apart a bit with a girlfriend of his that he felt very committed to. But his girlfriend really was reluctant to be able to have them live together or really start a life together unless he became clean.
We mostly kind of just listened to him, and at some point he got stuff together enough that he is actually staying in a permanent apartment now and working, which, you know, I think that the biggest thing we can possibly do is get somebody back on their feet.
He's been so happy with the progress he's been able to make himself. You know, we don't make the change for them, we just help facilitate it. So he's the one who actually made the change himself, and he's loving his life now. It's a simple life and he's very happy with it.
One specific incident occurred with a woman that comes here to our soup kitchen. One of the doctors asked could they come into my office so they could talk to this woman alone, and she had been raped and she didn't know what to do or where to go. The doctor that attended to her was so compassionate and so caring and gave her such a sense of support because she was experiencing pain. She was worried that she had a heart attack or that she was having problems with her heart. The doctor assured her that it was panic attacks from what she had experienced, and the doctor walked out of here with her in support of helping her to get where she needed to be. It doesn't get any better than that. For someone who has nothing, who lives by coming to a soup kitchen on a regular basis, and we have people here that care, and that's exactly what the woman said. You really care, you really care. And she cried, I think, more because she felt so comforted that someone cared. It helped to take away the pain and the fear of what had happened to her.
The current resident here is the only one. He's had recent problems with his stuff getting stolen, and probably the biggest thing we've done for Amari is getting him a backpack. He actually has taken classes at RAC, and he was hand carrying all of his books, and just having a backpack so he can get back and forth was probably the most medical thing we've done for him. So it's never what you think it is, or never what you think they need, but I do feel like we make a big difference for people that are pretty forgotten.
This one tent location that's been there for 2 years there's one individual there. When I first started visiting, again, 2 years ago, almost 3, in fact, there were 10 people living there. So again, it goes back to regularly contacting them in their environment, showing concern, meeting basic needs, and then again, with the doctors, say, hey, let me take a look at that arm. What happened? Just that contact and that concern and meeting those basic needs over a period of time and encouraging, you know, the people we meet to start addressing these needs on their own has really made a change. And now, in some of these locations, either the individuals we meet are living in a shelter, which is definitely a big plus, or they're actually stably housed. They're actually on their own. And it's a result of just continually going out there, visiting with them, and helping them help themselves.
We've seen some folks that have come in sometimes 3, 4, 5 times a week or a month, and then the next, after we get them linked in with all the services, we get them up and running on their medications that'll help them therapeutically, then they will come back maybe 6 months for something totally unrelated and say, hey, remember me? I was that guy that was in here every night. They don't know, patients don't know where to go, or they have a serious distrust of the healthcare system, or a fear of what it might be, that they couldn't afford the medications, that they have nowhere to even keep the medications safely, that they don't have the appropriate drinking water to take the medications. Now, this is just one of the ways where we can bridge that gap to get them to rebuild trust in the system. So the street medicine program allows them to access that primary care in the place where they are, not coming to the healthcare system, but having the healthcare system spread out to them.
But as our program continues to grow, and as we continue to add on services, and we continue to see that we need to address not just their physical health, but their emotional health, their social health, their spiritual health, and we can start to put all these pieces together, I think we'll start to see these individuals move into a more traditional care setting.
To have the doctors come to them and say, listen, I want to care for you, I want to know your name, I want to know what problems you're dealing with, and I want to help you. That's a very, very powerful thing.
This sort of a situation happens to people who never dreamed that they would be in this situation before. And certainly with the assets that we have, the wonderful individuals that we have in our health system, we are going to be able to continue to provide this wonderful care to help some of these individuals and continue some of the success stories that we have seen with the street medicine program so far.